you can make things happen by thinking about it and by that drive and innovation. You don't give up, and that perseverance, that determination is fundamental to this.
Welcome to the conversation. In today's episode of Trailblazers, Johnny is speaking to Dik Barton, health, safety and security advisor and former Titanic diver. We hope you enjoy the episode. Be sure to subscribe and follow us on social.
Dik, great to have you, mate. Finally got there in the end after much rescheduling.
Yeah, I'm afraid so. Illness, travel, and other issues take their toll, for sure. Great to see you.
How does today find you?
Yeah, we're well today. We're enjoying the Cumbrian summer of intermittent showers and rain. But apart from that, it's seamless. Yeah, all good, thanks.
Standard British summer. So, Dik, for those who are uninitiated, give us a little background into yourself and the journey that's brought you to where you are now.
Yeah, crikey. It's been a journey. So I started off life many years ago. In fact, I don't measure things in time anymore. It's now in kilos. It's much easier to correspond to. So about 20 kilos ago, I guess, I started off life as a commercial diver in the saturation diving world and tried to make my way there. Sadly, the timing wasn't good, and the ROV industry kicked off and divers were expensive. And so I made the natural transition, of course, from that into the military. But rather than Navy, I went to the Army, so I really can't figure that one out. Moving fast forwarding on through that into the Parachute Regiment and then into the world of intelligence, and then leaving the British Army out in Hong Kong after a illustrious 14-year career as an officer. I then moved into a short term into some kind of offshore maritime security work while I found my feet. And then the chance of a lifetime came around where I was invited to join a company called Titanic Incorporated, a US operation who were looking for a director of operations. And the company was responsible for diving the wreck of the Titanic, and they asked me to join them in that role of coordinating all operations, both on and offshore and subsea. And that was 7 years of very exciting diving of the wreck, some 22 dives on the wreck during that time, and then moved on into other industries as the company stopped going from expedition to exhibition, which we're doing worldwide. I then moved into oil and gas industry, and now I have my own business, which is a medical device business. So it's pretty much a unplanned, scheduled evolution, I think. Yeah.
How was it that you found yourself, and what were the experiences that informed that transition from oil and gas and then into medical devices?
Yeah, I think there's a common theme there, albeit slightly twisted. I think it's all to do with really how we deal with operations and circumstances and situations and respond to those emergencies. And so the genus really of the whole medical device business was based upon looking at how we have casualty management systems and the equipment to facilitate that. And as a consequence, we have designed two very exciting, innovative products, which I can talk about later.
Absolutely. Yeah, I'd love to hear a little bit more about those. What were some of the key lessons that you learned from the 22 dives down to the bottom of the Atlantic Ocean when you were recovering items from the Titanic?
Yeah, it's a long way down, and it's an even longer way up with anticipation, of course. So the dive conventionally takes around about between 8 and 18 hours, depending on the actual profile of the dive and what you're doing and where you're going and why. We have 5 dive profiles per dive. We've already had dietary constraints before we dive because we're in a submersible, which is 3 men my size with very little options of loos or any kind of refreshment. And the focus is very, very clear on the expedition dive itself. We all have a job to do, whether you're a pilot, a co-pilot, or an observer, and we all have to be very much integrated in how we operate. So I think the lessons learned very simply there are planning and that ability to be able to think of contingency, which has served me well throughout my entire careers.
Incredible. I mean, you said there from transition to expedition to exhibition now. Where are the exhibitions taking place currently?
So currently the company is still in operation, albeit under a different guise, but they're currently in the Far East and in the US. and the exhibitions comprise of around about between 8 to 3,000 artifacts, depending on the type of exhibition. But there's normally about two or three concurrently. And during our tenure, we picked up in excess of 10,000 artifacts. But that ability now has stopped because the company no longer has the capability to dive to the wreck to recover artifacts through manned operations. Those submersibles are no longer available. They've been decommissioned, and now it's all done by remote operated vehicles.
So, talk to me about the inspiration behind the medical devices and innovations that you're currently working on. How did they come into being? Where did you get that spark of inspiration?
So again, through the evolution of time and having been unqualified in the School of Stupidity, which I graduated with a very high level of competence, we've been through some pretty arduous and difficult and very often challenging environments. And I worked out that there has to be a better way of managing a broken limb by using a National Geographic magazine and a sock. We can get it more sophisticated than that. And so over reflection, I was thinking, well, we've picked up artifacts from the seabed for Titanic. We transmit them and carry them all over the world, quite literally. So during that period, we found some packing foam, which was a two-part activating polymer foam. And we basically made a home for those artifacts, those priceless, very fragile artifacts, by forming the foam, placing the artifact into it, and then it transitions from Sunderland to Singapore to wherever it may be. I joined the dots up and thought, well, that foam is really quite exciting. We can then reverse engineer that chemistry, and exactly what we did, so we made it into a limb splint. So that function now, by utilizing that chemistry, we redesigned it. We have a Coca-Cola recipe now for the polymers, and it now forms within 3 minutes and forms a gutter-shaped splint. So basically, it immobilizes a limb injury. And that was really our premium and first product off the line. That comes to market at the end of this year. But then reflecting yet again in life's experiences and predominantly through military exchange, but although I wasn't involved in it by any means, but the 3rd Battalion, the Parachute Regiment, were involved in Kajaki in Afghanistan. And tragically, 3 of the guys walked into a minefield and suffered life-changing injuries, amputation. And there was no real way of being able to get them out of that minefield because a conventional stretcher is a large, heavy, unforgiving, rigid piece of kit, and the boys weren't carrying one. So there's no way extricating them apart from the extremely extraordinary, brave actions of Tug, who was the medic at the time. So again, fast forwarding, thinking about this in reflection, talking to friends involved in the scenario, and also emergency services and military in extreme hostile environments, we designed a sleeping bag style stretcher, which effectively is lightweight, portable, unfolds, rolls out, and does what it says in the tin, and is now a revolutionary piece of kit. And that's now starting to get some traction into the medical response and military scenarios.
Have you been able to test this in some sort of pilot with people already?
Absolutely. So we have units deployed in the Ukraine. It's proven to be very successful and very, very well received because of its portability and its ease to use. Because it also can carry heavy loads as well as people. It can use ammunition and equipment. But also we've been through the whole legislation and compliance aspect, and we're now working very heavily with emergency services, helicopters. We have some significant traction in Africa, predominantly in Tanzania, where we have equipment deployed in remote site clinics and mining operations where, quite frankly, you're in the middle of literally nowhere, right through to safari, helicopters, and supporting poachers in Mozambique and Botswana. So that's very exciting. And now we're just literally moving into the same application for the global wind farm operation for wind turbine rescue and extrication.
Wow. So there's huge applicability for an innovation like this. Why do you think it has been that there's just been no consideration to something like this before now?
Well, Johnny, you'll hear it yourself 1,000 times, and it drives me mad. Well, that's how we've always done it. And it's not broken, so we won't fix it. It's carries on. But there's so many ways we can change. We don't use telephone boxes anymore. We use mobile phones. We put a seatbelt on when we get into a car. It becomes muscle memory. We don't smoke in pubs and restaurants. Things change. We move on. And there's always time to move on and change. And there's always room to change for a reason, not just for change's sake, but actually for a beneficial reason. And that's where we've hit a market need. And that's where we're so excited about our opportunity of our products and how it'll change casualty management. And then with the advent, of course, of drones, because our equipment is drone portable. So a very simple scenario would be that the paramedic could be on the hillside, tending to an injured person. We can fly up to him a stretcher and a stretcher board, which is a folding unit, makes a composite rigid stretcher, by which time the mountain rescue guys can have trudged up the hill, moving hopefully a bit lighter and quicker because not carrying a stretcher, and can then safely extricate the packaged casualty. So it's also thinking about things in a different way, not just the equipment, but also the concept and applications.
What sort of size does it fold down to? Obviously, you've mentioned it's exceedingly portable and you can fly it in via drone. What sort of dimension size are we looking at for this?
Yeah, it is a conventional sleeping bag size. So I guess it's in new money, it's approximately 50 centimeters wide by about 40 diameter. Weighs just over 4 kilos. So it's phenomenally man portable and easy to carry. The board itself is a 8 kilo board, which folds up into 3 panels and unfolds, and then through an integrated system fits rigidly inside of the stretcher. It's called the sledger because we call it a sled and a stretcher. It can be dragged, and then by putting the casualty in there, folding over the wings of the sledger, the casualty is completely packaged and then can be lifted either by helicopter or in the vertical or a conventional extrication system, or dragged and carried by a 4-man team.
That's absolutely amazing. So something that could pretty much fit into a large backpack that enables the triage and extrication of a patient from a very tricky environment and a very tricky situation. That's absolutely amazing. With regards to the expanding or the foam piece with regard and how you can set a broken bone, tell us a little bit more about that as well.
Yeah, so we call it the META, was a medical emergency trauma appliance. So it's an isolating splint system. It's a gutter shape, so it comes in a small bag. You activate the two polymers externally, which then take about 3 minutes to form. As they're forming, you mold it around the limb. Currently, it's a forearm, and it forms a gutter. And what that does is then, and it's held in place by cohesive tape or veterinary tape, as it's known probably more commonly. And then effectively that then immobilizes that limb, so you can go from the point of trauma through to triage. It can go through the X-ray system. It can be inspected quite easily externally without having to interrupt with the actual injury itself. It'll conform to the shape of the injury, of course, because invariably it won't just be a straight line. It can be quite traumatic. So there's a huge amount of application to that. It's a once-only piece of equipment. You don't need to be a technician to use it. And we're hoping to have these in every single defibrillator box around the country, on the belt of a policeman, right through to anywhere where there's a high footfall, right through from the paramedic to a military scenario to you name it, wherever there's a risk, effectively exposure, even down to the weekend warrior who goes away for the weekend up the hills, cycling or hunting, shooting, fishing, have it in the backpack. It's a very versatile piece of equipment, and we're very excited about it.
It sounds like there's a consistency of theme throughout these two products that you've mentioned, which is maximal utility and diversity of environments that they can be used. Is that a lesson that you picked up from all of the different experiences that you've had, where you've realized over the course of this checkered past, let's put it that way, that you have, that you need those pieces of equipment, you need different experiences, different touch points that assemble into something that can actually have that maximal utility?
Yeah, 100%, John. It's all to do with what what can I now not do as a consequence of the event? What has caused the event is irrelevant. That's of no consequence whatsoever. So therefore, my contingency is what do I need to be able to cater and manage this event? And we're focusing here on obviously health and trauma and exposure to injury. But we also look at as a company, we look at how materials are used and the advent of materials, and that's right through from garments, textiles, through to chemistry. And we're very proud to say we've just been nominated for an award in San Diego in September this year, which is called CAMEX, which is to do with a composite materials exhibition. And a very clever man in James Dewhurst Weaving in Lancashire has managed to weave together polyester strands, and then it ends up in a mat. Then another huge brain in the US has managed to work out that by compacting in high pressure compaction and high temperature, this mat can then be bonded into a solid, extremely powerful, resilient, and had ballistic quality material. So we've now managed to take that technology one stage further. It's now being used in NASCAR, for example, and it's a replacement to carbon fiber. It's lighter, quicker, stronger, and much cheaper. But we've now made our own new innovative spine board, folding spine board, from this material. So we've taken that step one more into a very exciting arena whereby we've halved the weight, we've increased the tensile strength and the versatility of a conventional spine board, which is a large, heavy, rigid, unit. So it's all about innovation and thinking out of the box. And there's some incredible equipment and materials out there which we haven't even started, I think, really. It's very exciting.
I love this. And I think that the mindset that you adopt around innovation and the ability to look at different places and spaces and then an ability to use that knowledge to apply it to a particular problem is something that, from my experience, definitely the medical field needs much, much more of. How do you, how did you come to adopt that mindset of innovation and learning from these different places? Is it something that you've always had? Is it something that, you picked up over time? How did that make its way into your kind of modus operandi?
Well, the regimental motto of the parachute regiment is "You shrink apparatus is ready for anything." So that resonates with me. But going back before that, when I first did my aptitude testing for commercial diving, because you can't just go and do it, you have to actually have a psyche test to make sure you are clinically insane. But apart from that, you have to do a physical test as well, which was you're put into a horrible, wet, leaking dry suit, which is a contradiction in its own right, a pretty rubbish helmet mask, and it's in a big tank. It's nasty, the visibility is poor, and they throw into you a canvas bag, which has got about a 10 mil chain, a cleave bolster, and a 4-pound lump hammer, and you're told to cleave that chain. And your natural instinct, of course, is to try and place the chain on the deck or on the sand, on the floor or somewhere and strike it. And the actual way you do that is you pick it up and you bend it, you put the bolster upright, you put the chain over the edge of the bolster, then you strike the chain. So you're making the efficiency so much more precise, and it actually works. But you have to work this out, and because they've given you this task for a reason. Because it's not just easy. You're not just said, well, here, split the atom with a boat hook, mate. Off you go. There's obviously they're looking for something a bit more in depth, no pun intended. But it's just thinking about how you actually deal with these things in the scenario and adapt and overcome.
What was it that got you into diving?
There's an incredible diver who was probably before your time, a man called Jacques Cousteau, who was my lifelong hero. So on BBC Two on a Sunday evening, Jacques Cousteau would come on and we'd sit there with sandwiches watching it, and that was really my inspiration. Yeah, and then later on, as I evolved, having destroyed my mother's Hoover and mocked up my own aqualung system for my diving expeditions in the back garden, yeah, I then managed to make it a reality.
It sounds like there's a strong spirit of adventure in all of your endeavors. And with that in mind, are you doing anything with the team at World Extreme Medicine with the Sletcher and this other product that you're looking at? I think there seems like a natural tessellation between those two pieces.
Yeah, certainly that's the aspiration. We're just getting our ducks in a row now. Funding is always a challenge, of course, because we have to fund and make our own equipment and the units. So we've now got an extraordinary manufacturer who's ex-military. He's also a fireman. He also climbs, and he understands all of the nuances and requirements of the equipment. So that, coupled with, I say, a funding round, which we're about to go into, and we're desperately looking for a funding opportunity of somebody who was prepared to be involved. Money is available, but we want to get the right money. It's the right place, the right person, for the right reason. It's not just an equity share. And then World Extreme is absolutely definitely on our target list to do. We're just hooking up now with UK Resilience, who are a new operation and doing some great work, predominantly around the charity and medical support sector in the UK. And they have an exhibition starting off in September this year, which we're going to be going to. That's in Bristol. But yeah, we really want to get out there. It's exposure. It's just getting the awareness, and I love, and thank you for the enthusiasm, support, and opportunity to showcase ArmaTrex now, because it's really, this is the airtime we need. It's been a 7-8 year journey, to be honest, which has been bootstrapped by myself and latterly my business partner, and I'm running out of kidneys now, so I just need to get some more money from somewhere else. Yeah,
Well, I think it's truly inspirational what you're doing, and the simple fact of the matter is there's so much, as I see it, in terms of synergy between frontier medicine, for want of a better term, and what you're doing. Because if you're able to carry these pieces of equipment into situations and scenarios where you might not actually usually be able to treat someone in an effective manner that gets them to a place where they're ultimately going to get the treatment they need to survive and hopefully thrive off the back of that treatment, then you failed almost at the first hurdle.
sure.
And providing that to people is vital, and particularly in a package that's able to be carried. You're talking about a 4 kilo sleeping bag with an 8 kilo board, and then something that fits into a backpack or on a belt. These are things that are true game changers if you get them into the hands of the right people. You mentioned your business partner. I wanted to ask who the other people that you were working with are. Obviously, wanting to shine a light on all of the incredible individuals involved in the projects that you're doing.
Yeah, so I'm blessed to have a wonderful business partner, lady called Adele, who really she's my conscience. She keeps me on the straight and narrow, because I get creative and go down rabbit holes, and she pulls me back and says, "No, let's do this one first." He runs the business effectively for me, and then we have some other extremely talented individuals who are on the books, who are really the technical go-to support, and they help and advise us. So when we devised and put together this lecture, it was how we devised and put together the actual harness inside. Initially, I started off with a pelvic harness, and I was advised strongly against that by a medical technical advisor. That's the place you don't want to restrict because of obviously femoral flow and all the rest of it. But we did have a chest harness, which basically secured the casualty inside the sledger. So it's those really clever little innovations and guides that we get, and we're blessed with some tremendous support from guys from the military right across the rank of emergency services and National Health Service and so on. I will add also that our stretchers and our excuse me, our splint are all medically compliant, MHRA, MDR Class 1. So we've been through that whole process of compliance and making sure we're completely correct, and also for obviously lifting and any poor endorsements and Lola. So we've spent a huge amount of time being incredibly diagnostically compliant, to make sure we're correct in what we do, but that hasn't restricted us in developing the whole concept. The Meta Splint is so exciting because it's currently a family of 5, and they vary in size right through from wrist ultimately down to full leg, which is our next endeavor. As a walking splint to walk out of a hillside, or in a military context to be able to carry an injured person rather than 3, it goes down to 2, 1+1, with the obvious benefits of that. And then, of course, the application of the same process into the veterinary and the equine world as well, which is just extraordinary. Working with a close friend of mine who's a vet up here in Wilds of Cumbria. He loves it. He's an extreme marathon runner, and he also wants to have one of these on his belt as well. So, and then we look at the Sletcher family. That's a family of 8, and they all relate to different scenarios. So there's a maritime, a military, a medical, which is /air. We've produced one for the mortuary industry, which is slightly bizarre, but effectively the scenario is, or the way you relate to it is that when we go shopping, we don't take a plastic bag every time, we take a canvas bag. So our mortuary Sletcher is basically a bag for life. So if you have a mass casualty incident, which sadly does happen, the first things we run out of are body bags. So we've designed this system whereby the Sletcher has an integrated disposable body bag liner into which the body or the parts, whatever, are placed, transported easily by the Sletcher from point of event to a storage facility. The bag is then slid out and left, and then repeat. We put a new bag back in and go back again and do it again. And we've done the same thing for the aviation industry, which is also crying out. There's 1,000 people a year die on commercial airlines globally. Whilst that may not appear a big number, if it happens to you and it's your loved one, or you just happen to be a passenger, it's not a pleasant experience. And IATA currently don't have a real policy other than placing the deceased, once actually declared deceased, into a seat, wrapped in a blanket, eye mask on, seatbelt on, and land. So you have all of that.
Yes.
Look at the trauma of that, and for the air crew as well. And it's not easy for them to handle a body. It's very difficult, very demanding, and traumatic. So, yeah, we've looked at many different user group scenarios around the world and different applications and different ideas.
It's funny that you mentioned the airplane situation, because unfortunately I had experience with that exact situation. So a few years back, I was on a flight going to Thailand and was going off to a training camp to do some Muay Thai training. And a passenger on the flight, a gentleman, had unfortunately suffered a cardiac arrest, had been taken to the back of the plane to be resuscitated, and unfortunately they couldn't revive the gentleman in question. And my friends and I, who were obviously pretty capable people physically, were asked to have the responsibility of picking this person up and putting them into a bag, as you say, and then carrying them into the back seat of the plane in the passenger quarters, and then propping them up in the corner of the plane. And luckily for myself, I'd had experience with this type of thing previously, and my parents had owned a care home. I had unfortunately seen this. So this was part of the kind of situation that I found myself in, where I was able to deal with it fairly well. But for those people that haven't had that experience, that's an immensely traumatic experience, from, as you say, from the cabin crew themselves to the other passengers to the people that unfortunately find themselves in the situation that myself and my friends found ourselves in, which is, we've got to pick this poor soul up and put them in the back of a chair at the back of a plane, and equipment and resources that would have been able to be there and affect the situation for the better would have been all the more valuable in those extreme situations. I wanted to ask actually about the thing that I think is so fascinating and so interesting about the journey that you've been on is the diversity of utility that you're able to cultivate with these two products, and the fact that whilst the solutions themselves seem, I guess, to want of a better term, somewhat obvious and simple, because you're tackling what starts as a very simple problem. How do I make sure that someone's leg, arm, forearm is splinted effectively in an extreme situation? How do I stretcher someone out or find a way of getting someone out of a hostile or extreme situation in a way that means they get the recovery that they deserve? It fascinates me, the product development cycle that you will have been on. And you said that it's taken 7 to 8 years for you to get to where you are now of this. Tell us a little bit more about that product development cycle, where it started from those first beginnings, that green shoot of an idea, and how you've iterated on, how you've evolved the concepts as you've developed them.
Well, like any good innovator, you start off with an action man, and I made a very simple stretcher for the action man, and played with that and looked at that, and I walked into who later became a very good friend of mine, working for a company who garment manufacturers, and said, "Hey, listen, I've got this really cool idea. Let me show you my action man." And he very politely said, "Sure, no problem at all." And we basically sat there and blue skied this whole thing, this whole concept, this idea, and looked at the actual use of materials and textiles and how we can make this work, light, strong, durable, etc. And effectively, that demand and that requirement for the versatility of scenarios evolved from that thinking. That's that school of thought. That what's the question? What's the problem? What's the solution? How can we make this work? And having a stretcher is not just the solution. It's how that stretcher is physically carried around, how it's physically got to the point of need, and more importantly, how it's actually used and how it's deployed. Because we can get spine boards and scoop stretchers and all the rest of the great stuff is on the market now, but they're pretty binary in their application. And so we had to think about also the scenarios whereby this could be a different application in a hostile environment where somebody is an amputee, for example, he hit an IED, and his center of gravity is now significantly shorter. So we've also built in a characteristic in the stretch so you can foreshorten it. So if you have a conventional length person and they've lost a leg or both legs or seriously damaged the lower limb, then we can now shorten that up. And that enables the rescuers to operate more efficiently, because it's not just about the casualties, it's how that's implemented. And taking that one stage further again, we're now looking at, of course, drones and technology, how it's advancing. So we're not just talking about delivering the actual stretcher and board to a site of trauma or isolation, but also the extraction. So the casualty evacuation process now, so the Ukrainians have been using drones to evacuate casualties from the front line now for arguably the last 18 months. The MOD, British MOD, won't yet do it because they deem it too dangerous, i.e. risk of being shot at. So if I was given a scenario where I would run the risk personally of being extracted by a drone, then being risk of being shot at, already being shot at, so I don't want to get shot up again, so what? So what we're talking about now is putting our stretchers into those casualty evacuation drones, flying them forward, so you can take 10 of our stretchers forward, fill one up, bring it back full, and leave the rest there, and then keep that cycle going and keep that process going. So it's all about also logistics and how we manage and deal with those different scenarios and how that's managed viably, economically, and efficiently. So it's a number of aspects that come to play in all of this process.
Yeah, it's really interesting to me because even as you're describing that situation there, I'm thinking about how you might then even layer on a layer of experience that's digital. And hear me out here. I think one of the things that could be really interesting is in environments like mountaineering, for example, where you sync up with the drones, you provide the person who's going off on a solo hike, a solo expedition themselves, where they have kind of like a little alert device on them, that actually deploys one of the drones with a stretcher if they find themselves in difficulty. So if they fall down, it could be a GPS tracking piece. It then alerts the drone. The drone flies to their exact location, provides footage of the terrain to anyone that might be a search party. That's then fed back via a 4 or 5G signal. So anyone who's deployed from search and rescue goes to go and see that. You have the visibility of that terrain. You have the exact location in terms of GPS coordinates, and that person has the Sletcher delivered straight to them via the utilization of digital technology as well as the Sletcher itself.
Love it. Absolutely love the idea. And we've sort of kicked that around on the proverbial whiteboard, but not to that level of sophistication you just gone through there, because the idea of us pre-depositing a Sletcher to an injured person in isolation is available to him as a environmental protection, because you can get it out, you can crawl into it, and then you wrap it around yourself, zip it up, and you can then be comfortable waiting to be rescued. At the same time, your pinger is going, whatever that may be, EPIRB or whatever, and so you're being located. So yeah, there's no end of, as you say, absolutely right. The onion skin mentality, the layering of this, because layering makes it stronger metaphorically, it makes it more resilient metaphorically, but it also gives you the much more that versatility and adaptive to the environment. So our maritime version, for example, we've taken our expanding foam polymer foam from the splint, and we've put that into the maritime version so it floats. So rather than having conventional air or some kind of vacuum system to keep you afloat, which invariably punctures or is not reliable or has to be inflated, this activates through chemistry, and it gives you some sponsons, basically some pontoons, which are attached to the actual particular maritime version, which is foreshortened as well. It's 2/3 length, because it's easier to manage in fast water rather than a full length 1.8, 1.9 meter stretcher, which is difficult in fast water or moving water. So yeah,
So how are you?
I love it.
I was just going to ask, how are you testing these things in the wild, and how are you getting the feedback from them?
Yeah, so again, we've been very fortunate. I spent quite a few weeks recently down in South Africa. I was working with Rescue SA, who are an amazing bunch of individuals based out of Johannesburg University. They have an extraordinary test facility there they just built, an amazing pool, which goes from mill pond up to a force 8 in the space of 2 minutes, with wind machines and tide machines and strobe lightning. And the guys tested it all there for us. They loved it, came back with some great responses. There's a big exercise in Johannesburg in Aggeep Dam in September, which we intend to get some equipment out there for the emergency services show to test, and the military. We've done a lot of testing here in conventional swimming pools in the UK and in the northeast, in the water there in the sea, and up mountains and around and about. We're looking to work with air ambulances. We're desperately trying to get an association with air ambulance services so we can get the kit into it. We have it already deployed in Tanzania in air ambulance and also safari helicopters, because it's so small. It also fits nicely. It's easily deployable. If you indulge me very quickly, I'll give you a classic example of why it's so adaptable in a helicopter, is that to put a conventional stretcher into a helicopter where you take the left-hand seat out, you have to have two clips which have to be post-fit or pre-fitted into the airframe to which the stretcher clips into. You then also have to have underneath that the equivalent of we have a car boot liner in the back of our car for the dogs and the welly boots and everything else. So you have to put a plastic liner into the helicopter, because the body fluids and bloods which inevitably leak from an individual are actually very corrosive for the airframe, so they have to be contained. So our solution is great. We don't need any of that. We literally get the Sletcher out. We have the board inside, or the casualty is wrapped. He's placed inside, and he's affixed by strong points to the D-rings on the deck of the helicopter. It's just so simple it hurts. and when it's not being used, it folds up into the aft locker and sits there. So you don't have this constant, great big rigid thing to deal with.
I mean, as I say, it's so diverse in its utility, and the way in which such a simple premise has been executed across all of these different situations, I find it's one of the most elegant pieces of product design that I think you could come across, because that is really what you want from any decent product, is that diversity of utility. With regards to connecting the dots, because you can only do that whenever you look backwards, are there any experiences that, now that you look back over the different experiences that you've had, either through the army, through diving and this and that and the other, that have informed the ways in which you've gone about testing things and the ways in which you thought about things from the very beginning for these two products?
I think the real I don't have regrets because you just make mistakes and you learn from them. So there's the positive spin to that is that, yeah, I wish I'd been born. Well, I wish you can wish all day long. You can make things happen by thinking about it and by that drive and innovation. So I think, in answer to your question, really, no, there's not any one particular thing because it's evolved, and those iterations have evolved by mistakes. Leonardo da Vinci, he created the first helicopter unknown to him. The bloke that did the light bulbs, as they say, it took him 999, and all of a sudden, the thousandth one actually lit up and worked. So you don't give up, and that perseverance, that determination is fundamental to this. We work with ballistic nylon, which has tremendous qualities. We've just done another very interesting little side product, which is going to be used in the violence in the workplace application, whereby ballistic nylon effectively is slash proof. It's designed for, and it's a clue in the title, to be strong. But we have to deal with some strange and eccentric people in the workplace, particularly in medical institutions and A&Es, etc., where the staff are at risk. But also you have to protect the assailants too. So we have a very simple system, which is called a vector assist, and it's used by 2-3 people to encapsulate and contain an individual, and can also be used to carry them as well, because it has a 180 kilogram payload. So it's just the adaptation of these different products by stitching on some heavy duty nylon loops, thinking about it, the ergonomics of it. It folds up, it's the size of your laptop, it weighs 420 grams, it's super light, it's washable, it does what it says on the tin, and there's no working parts to it, there's nothing difficult, no batteries to change or extensive training. It becomes very apparent in its natural application. So it's all about the materials, the textiles, the technology that's coming out all the time. We don't do it that way anymore. We do it this way because it has to change.
It sounds like you've got some really exciting stuff on the horizon. So what's the next 6 months looking like for you for the half of 2024?
We're full on. We've just finished our catalogue. That comes out on Friday. We'll then get our website up and running next week, which has been a labour of love and torture. And at the same time, we hope those will be a platform for us to showcase ourselves and look for investors and market traction, really. It's just, it takes time. It will happen. Fever Tree did a good job. They reinvented tonic water, for God's sake. How many tonic waters are there? But they cashed out and did a great job. Brewdog, great job. Well done, guys. And I love that innovation. There's many ways to look at this, and we just need that break now, which we'll get. Will come, and we're hopefully exciting. End of this year and into next.
Incredible. If people want to find out more, if people want to get in touch, where can they go? Where can they find you?
Yeah, as I say, the website will be up and running, but the company is called ArmaTrex, ArmaTrex.co.uk, and email myself, please, at info@armatrex.co.uk, or best place quick to find us is on LinkedIn. We've got quite a established LinkedIn page now.
Fantastic. Dik, this has been an absolute pleasure, sir. Thank you so much for your time. Thank you for sharing this incredible set of innovations with us, and really look forward to seeing where the journey takes you.
John, I'm indebted to you, honestly, and a great opportunity. And I've really enjoyed meeting and talking with you. And thank you for, for letting us have some airtime. Brilliant. Appreciate it.
Incredible.